You know, it feels like everybody around the world has been talking about the royal baby, but for moms-to-be, women everywhere, of course, we're also talking a little bit about how Kate decided to maybe proceed with her pregnancy and, of course, the birth of the new prince. Joining us now is Dr. Chouchani. You know, I appreciate you being here, especially as a gynecologist, and we don't always have gynecologists on winging it, but there are a lot of trends that Kate is blazing the trail for, and there are a couple of birth-related trends that she's probably making a little bit of precedent, or at least getting women talking about. One of them, which I think is really interesting, there's a lot of rumors out there that she went with the Hypno birthing, which sounds like it might be something a little more than it is, actually. Explain it a little bit.
Birth is just the attempt of hypnotizing, using hypnotism to reduce the stress and the pain associated with labor, to take your mind off of the pain and to look forward to the birthing process. And by doing so, you reduce stress. Baby doesn't feel the stresses. There's a good connection between you and your baby, as most women know. And that's really the ultimate goal. And more modalities are coming out to prevent that high stress level during the labor and delivery process.
When I was reading a little bit about it, when I saw hypnobirthing, I was like, oh, they're going to tick-tock the clock in front of our eyes. But really, when it comes down to it, it's deep relaxation techniques, which I think every mother could use in the delivery room.
Absolutely. It is a stressful process, especially at the time where the baby's just about to come out. The mother's in a lot of pain. People are coming in and out the door, the neonatology team, the doctor, the residents, the nurse, the staff. It becomes very stressful. The husband, sometimes they pass out.
Right.
So
we have not heard word that William passed out, but he was there, you know, reportedly in the room with her. They were trying to keep it very natural, low-key. And speaking of natural, I mean, I wasn't in the room either, so who am I to say? But she's rumored to have had a natural birth, opposed to a cesarean section. And I feel like for a while we were seeing a lot of celebrities go for the C-section, or for other reasons women were choosing C-sections. Now, is this going to be more of a trend, you know, or are people going to follow Kate's lead here?
I believe so. Cesarean section is a very invasive surgery, requires a longer postoperative stay. There's more involved, much more risk, and the healing process takes a much longer period of time. And in addition, you're not with your baby immediately after the surgery, so the best way to go is always vaginally. You're in and out of the hospital within 1 to 2 days. Immediately after the delivery, you can start breastfeeding, be with the baby, you can walk around. Whereas in a C-section, you're pretty much stuck to the bed.
That is major surgery. You know, one of the things a lot of buzz she was getting about is how thin or fit she was during pregnancy. She really made prenatal fitness and her health a priority in that way. Is that going to be a trend? We're going to see more women really trying to maybe rein in the weight gain a little bit.
We already do. A lot of my patients they're very active. They use the elliptical on a daily basis. We recommend it in our office. We promote patients' well-being, especially staying healthy. We recommend around 20 to 25 pounds for the whole 40 weeks of weight gain for a patient of her weight. However, you know, for certain different categories of patients, we might recommend more or less, depending on their weight.
Okay.
But we do recommend exercise at all points.
Yeah, you know, I feel like my mom used to say back in the day that they would, you know, you would sit up with your feet, you know, and eat the bonbons, or at least that was the, you know, the rumor. But you know, now women, if you've had an active lifestyle beforehand, you can keep that active lifestyle.
Absolutely.
You know,
we recommend low impact exercising as much as possible versus high impact. But we do recommend exercise in general. We
talked a little bit about Prince William being in the room with her, which reportedly he was. Is that we're seeing that too? I was watching Mad Men recently, and you know the dads used to wait out in the waiting room, but Prince William really taking an active role.
No, we get them right involved, and right when the baby comes out, we have them cut the cord, and they go immediately over to where the baby is resuscitated if need be, and they start taking their pictures, and they take a look at the kid, and all the facial features and who looks like who, etc.
Yeah. You think these are some good lessons that Kate and William have sent out to the rest of the world?
Yeah. Well, they got through the first one. I hope for many more, and I suspect they'll be much better.
Very good. We appreciate your insight.
Hey, anytime, always available.
All right, very good. For now, we're going to send things over to Emily Lenahan and the .com check.